Hello, NCO. This is Dr. Stephanie Diehlman coming to you with an update from Cactus Nazarene Ministry Center and the Well Health Center. Andy and I moved here about 4 years ago to join CNMC and help start the Well, both of which are compassionate ministries with the Church of the Nazarene. And the community we serve in, Cactus, is not your typical West Texas town. We have people literally from around the world, from Myanmar to Eritrea and South Sudan to Cuba to Guatemala, many of whom have come to work in the local agriculture industry. And it's literally like the nations have come here to Cactus. And that's why the Church of the Nazarene is here, to make Christ-like disciples. So the well's been open for about 2.5 years, and I guess more than half of that has been during the pandemic. And so Kathy asked me to share a little bit about that. And I'll be honest, I've made this video about 100 times now, because how do you really share about this year and how it's touched each of us? So what I decided to do was to share about some of our patients and our staff who not only have we been able to serve, but have touched my heart during this time. The first one is Maria, and her name's been changed to protect her confidentiality, but Maria was a lady in her 50s, and she works in a local tortilleria making tortillas. And so she sees a lot of customers coming in and out every day. And early on in the pandemic, she started to have some symptoms that sounded like COVID. Now, at that time, we hadn't even received testing supplies in our community. It was hard to get testing in bigger areas, let alone a remote rural community. It took much longer for those supplies to actually get out to us. But anyway, she came in, made an appointment because she was having a fever, and sure enough, she had some body aches and dry cough, and really was pretty typical symptoms for COVID. So we gave her some instructions on how to take care of herself. We prayed for her and asked for God's healing. And then we were able to give her a COVID care package, which was provided by the ministry center. Had things like toilet paper and hand sanitizer and cough drops and Tylenol, things just for people to take care of themselves as they went home and isolated and tried to rest and stay well with their COVID symptoms. And we were able to deliver dozens of those packages throughout our community through that time when we were seeing many, many cases. Fast forward a number of months to the time when we get the COVID vaccine, and that was thanks to some state resources as well as some grants that we received. We were able to do some vaccine clinics and to be able to provide that protection to some people in our community. Well, there were some folks that couldn't quite make it into our clinic. They were some shut-ins that were served by our CNMC staff as they delivered Meals on Wheels. And so they knew about this couple, the Santoses. And so they were interested in getting the vaccine. They were in their 80s and just had a hard time getting out. So we were able to actually, on our vaccine clinic day, go to their home and administer the vaccine. And when you get the shot, you have to wait 15 minutes. So we waited there with them to make sure they didn't have a bad reaction. And while we did, we just talked with them and heard about their life in Cactus. They had been there for decades. And so to hear about their time and the early days of Cactus was just quite fascinating, and even neater just to get to know one of our neighbors or two of our neighbors a little bit better. So those are the Santoses. And then finally, the last patient I'm going to share with you about, her name is Patricia. Patricia actually caught COVID last fall, and she was a little on the sicker side. She didn't have to stay in the hospital, but she did get put on oxygen. And was on that for a number of weeks. She was already one of our patients at the well, and so we followed her until she was well enough not to need oxygen anymore, and then continued to see her on a periodic basis for her blood pressure and low thyroid. Well, she came in a couple of weeks ago just needing a checkup for her thyroid, and the medical assistant comes to me and she says, "Dr. Steph, Patricia's oxygen is really low." And sure enough, it was 77% as she was just walking in. And so I watched it for a little bit, and it didn't get a whole lot better. Maybe 83% was the best, when normally you're going to be 95, 100%, something like that, with good healthy lungs. So we sent her to the hospital, and they checked her out and did some special x-rays, and it looked like she had a lot of scarring that was likely from COVID that she had in the fall. And so she was there for a night, was discharged home on oxygen, and came back to see us the next week. And we're working on getting her in with a lung specialist that's going to help us make sure she stays as healthy as she can in the next months and improve her as much as we can. But she likely has some long-term damage from the COVID, and we'll continue to care for her at the well, and we see actually a lot of her family members as well, and just do the best we can to keep her feeling the best that she can with her condition. So finally, I want to share with you about our staff, and their names are all real. Sarah and Carol and Elvia and Clarissa and Jessica, these girls have just served alongside of me tirelessly, putting their lives at risk. Actually, a couple of them got COVID and several of them thought they had COVID. Despite that, they continued to serve, loving their neighbors, literally loving their neighbors as themselves. And such a pleasure and a privilege to serve with these girls who are really heroes in my mind. So that's a little bit of our a year and a half of dealing with COVID. Thanks for all the ways that you have prayed for us, encouraged us, supported us through this time. It's just been quite unbelievable, but I'm glad we get to share with you a little bit of an update. And while I'm doing that, I just want to put in a little plug for the well. In the next few months, I'm going to be stepping back from my full-time position, and we are looking for a provider to come. So we're looking for a PA or NP or physician who has a heart or call for missions, who would love to come serve with us. So if you're interested in that or know someone who is, please check out the well. We're also looking for a clinic administrator just to take, as we've come out of COVID, we've literally exploded with prenatal care and children's vaccines and just ongoing family medical care, that we need an administrator to come and help with some of that as well. So if you're interested in either of those, just give me a ring, hit me up on Facebook, whatever. But we would love to find some folks to come serve with us here in Cactus. So thanks so much for this opportunity to share with you, and God bless you all, and enjoy your time together. Bye.